Hi, I'm Dr. Messina. Most of you know me from my YouTube videos at Dr. Undo Tattoo, but what you probably don't know is I'm a board-certified anesthesiologist with a critical care fellowship. This morning I read an article that says there's a growing popularity and demand for general anesthesia during tattoo placement. In particular, longer tattoos that take multiple hours and multiple days to place. And it sounds like a great idea to have your tattoo placed under general anesthesia where you have no concept of what's going on and no pain. But it could be very dangerous. When I say dangerous, it could kill you. I'm going to make a longer video because I think this subject is so important and I want to detail everything that goes on during a surgery. But if you're thinking about getting general anesthesia for a tattoo placement, there's a few things you better think about. First, that anesthesiologist should be board certified. Second, they should be using the complete monitoring surveillance during a surgery. You'll be surprised at how much monitoring goes into every patient during every operation, no matter how simple it might be. Also, when surgeries break an hour or an hour and a half, the complication rate goes up exponentially. So if you're lying there for a 3, 4, 5-hour tattoo placement on multiple days, your risk of complications from hypothermia to developing a blood clot to losing the airway goes up exponentially. When we're doing anesthesia, we always have a little saying, it's 95% boredom and 5% terror. And if that terror occurs in a fully credentialed operating theater where you have full monitoring and the full ability to resuscitate a patient that suddenly has a catastrophic thing happen, which is totally unexpected, your chances of survival are much better. If you're in some parlor somewhere or a house somewhere and you don't have the staff or the medication or the specific equipment to save this person's life, it's going to be a disaster. Some of the videos I saw regarding this had patients intubated, which is that tube that's going in your trachea. It wasn't secured properly, didn't seem to have all the monitoring, clearly wasn't in an operating theater. So wait for my new video, but if you're considering getting this, you better make sure all the T's are crossed and the I's are dotted.